Hi, Dr. Larry Altshuler here, back with you talking about healthcare and healthcare reform, telling you things that you won't hear in the media and you certainly won't hear from the politicians. Now, in lots of these videos, I've talked about the Affordable Care Act, and I've told you that the Affordable Care Act's harm is going to be much more than its benefits. In this video, I want to talk about an aspect of the Affordable Care Act which is going to be harmful and which is not really on the forefront, but is really going to impact your health. Briefly stated, the Affordable Care Act has targeted two entities. They've looked at these entities and they look at them as adversaries. If you like to even talk about it, enemies. These are adversaries to control. The government wants to control. One is the health insurance companies and the second, doctors. But let's, at this video, talk about the health insurance companies. Now, when the Affordable Care Act was first being discussed, they had what was called the government option. That, of course, was taken out because of all the hubbub. People really didn't like that. But the Affordable Care Act doesn't need that government option because in actuality, the provisions it does have is going to have the government taking over anyway. And there's two reasons for this. Number one, they're telling insurance companies you're going to have to do all these things that you haven't done before. In other words, you're going to have to cover pre-existing diseases. You're going to have to stop having caps on annual and lifetime benefits. You're going to have to cover a lot more people. Well, there's a reason we don't have all that now, and that's because it is very, very costly. To do that is going to put premiums way up. But here the government in the Affordable Care Act, at the same time as saying you have to cover all these, are saying, but now you can't increase your premiums and your deductibles and your co-pays. So you're going to have to give people all this, but you're not going to be able to pay for it because you can't raise those premiums. That's going to squeeze insurance companies, and they're not going to be able to do that. They're going to go out of business. The second aspect of this is called the medical loss ratio. This is basically the amount of the health insurance dollar that goes to actual health care versus administration. Right now, most insurance companies have a medical loss ratio of in the high 60 or low 70%. The Affordable Care Act is telling insurance companies you have to have it between 80 and 85%. Once again, this can't be done. Insurance experts will tell you that insurance companies can't survive by doing that because they have to administrate all this new stuff and it's going to be too costly. So basically, the Affordable Care Act sees insurance companies as the enemy and will be eliminated. They're not going to be able to make it. Now, I'm going to tell you, I'm not a fan of health insurance companies. I think they contribute to our dysfunction. They are drivers of healthcare inflation. There's lots of things they do I don't like. But I don't like the alternative, which is government-run healthcare, because the government is inefficient, it's very wasteful, it's duplicative, it suppresses innovation, and worst of all, it's not responsive to you. It sees everything in black and white, but medical care is not black and white. But that's the way the government wants it, and the government wants to control medical care. You do not want government-run medical care, I can assure you. But unfortunately, that's what the Affordable Care Act is going to result in. That's a real shame, but unfortunately, as it stands, that's where it is. Now, if you want to try to find out how to get around this and still get the best and most cost-effective medical care, go to my website, balancedhealing.com. There you'll find lots of information that will tell you what works, what doesn't work, what's necessary, what's unnecessary, and help you get the best care for your particular situation. So again, I thank you for coming and seeing this video, and I hope you'll come to balancedhealing.com and see my other videos and get the information you need to help you.